Welcome back here to What's Cooking Today, the nation's food, wine, restaurant, health, wealth, and entertainment program. Michael Horn with Debbie Barrera. Debbie, where we're heading there on the show? A little health segment?
Oh, yeah. We're headed to Dr. Rod Passman.
The importance of diagnosing and treating AFib. Dr. Rod Passman, welcome to the broadcast.
Thank you, and thank you for having me.
It's an honor to have you. We should mention that Dr. Passman is a cardiac electrophysiologist at Northwestern Memorial Hospital. He completed a fellowship in cardiology and cardiac electrophysiology and a master's degree in epidemiology and biostatistics at the University of Pennsylvania, and currently is a professor of medicine and preventative maintenance at Northwestern University Feinberg School of Medicine. He's also associate director of electrophysiology section in Northwestern and director at the Bloom Cardiovascular Center for Atrial Fibrillation, also at Northwestern. AFib, we're hearing this all the time. What is AFib, Dr. Passman?
Well, AFib is the most common abnormal heart rhythm in adults. There are probably 6 to 8 million Americans with AFib that we know about. And while AFib can cause many symptoms, the biggest concern is that people with AFib have about a 500% increased risk of stroke. So this is a disease that will affect, if not many of your listeners, certainly a lot of their family members, and particularly as we get older, we're all at risk of developing AFib.
And Dr. Passman, it could this could affect your favorite radio host. Raise your hands. Oh, my hand is up. I have what's called chronic AFib. I had the paddles to bring it back in. It went out 3 times, and then I was going to do the ablation where they kind of poke to see where the things are going to come, and yet I said, I don't feel it, so why would I do that? And the doctor said, well, you don't have to do that, but there is the risk of stroke. Tell us about it. What are the problems here? Some of the milestones and events that have come from new research, because I'm all ears on this.
Yeah, well, you raise really some very important points. And what's interesting is that this is a disease that everyone experiences differently. There are some people, like yourself, who may be in AFib all the time and have absolutely no symptoms. And there are people who have AFib for a few minutes every few months, but yet are tortured by it. You know, they are lightheaded, they're dizzy, they feel their heart racing. So people experience this disease in a very different manner, and the treatment is therefore different. However, whether you feel it or not, most patients who have AFib and other risk factors such as high blood pressure or diabetes or coronary disease, those individuals have that increased risk of stroke.
Right.
So while symptoms are important,
you got to do something about that, right?
Exactly, and I think for most people, blood thinners are the way to go. You know, we had one blood thinner for 70 years called Coumadin or warfarin, and over the last 8 or 9 years, we now have 4 new drugs that are probably better, safer, and easier to take than warfarin. So for most people, being on a blood thinner is going to significantly reduce your risk of stroke, but there are lots going on in the field that are available to patients with AFib or with stroke, and even people who don't know they have AFib. It's a really interesting time in the evolution of the treatment of this disease.
So what are some of those things, Dr. Rod Passman? We're all ears.
Okay, well, you mentioned ablation, right? Ablation for AFib didn't exist 20 years ago. We now can go into the heart with a catheter and eliminate the source, or at least reduce the amount of AFib in many people. So this is a complex procedure, but for people who are bothered by their atrial fibrillation, who have tried medication and cardioversion like with the paddles like you described, and where that doesn't work, then this invasive procedure called ablation is a really viable option. And when I first started doing that procedure 20 years ago, the procedure would take 12 hours, and now we could do this procedure in less than 2 hours with a much higher success rate and a much lower complication rate. So that's just one example of some of the progress we've made. And I think the other example of progress is something that we're all now familiar with, right? It used to be that the diagnosis of atrial fibrillation was made because you had symptoms or because your doctor picked it up on a routine exam. You came in for your yearly exam, and either by examination or an ECG, your doctor would tell you you had AFib. Well, as you are a good example of, you may not know you have AFib, and while your AFib is there all the time, for many people, AFib can come and go. So the fact that on your doctor's office you didn't have it that day doesn't mean you don't have it. So there's now a whole long list of options that you could either download or buy for your smartphone or your smartwatch that has a technology in it that will sense your heart for atrial fibrillation. And this new generation, Yeah, this new generation of Apple Watches will tell you if you're having atrial fibrillation, will have you touch the crown of the watch and actually record your EKG. So every day I have patients coming to me saying, my watch told me I had AFib, I felt nothing, and they're self-diagnosing this disease.
I want this.
Well,
where can we go to get more information? Give us the website.
Sure. So come to the Northwestern website at heart.nm.org, or you can go to the Heart Rhythm Society. That's our professional society. That website is hrsonline.org.